Hi, today I'm gonna perform the IV push with saline lock. The medication I'm using today is metoprolol 5 milligrams over 2 minutes. After verify with patient with the doctor order, I'll go ahead and draw the medication. Available dose is 1 milligrams per 1 ml. The order is 5 milligrams, so I draw 5 ml, and it will be filtrate in over 2 minutes. Before giving medication to the patient, I also do fire rise, check with right patient, right role, right time, right dose, and right medication. I also check with patient allergy. After everything performed, I verify patient name and patient date of birth. Also double check with patient allergy one more time to see everything matching. I could go ahead and set the IV side to see any sign of swollen or redness, discomfort. Everything look normal. I go ahead and clean the pore. And lean the side for 10 seconds, and then allow 10 seconds for it to be dry. Before the perform IV push, and go ahead and flood the tube to make sure on the remaining fluid on the tube is out, and because sometimes they have some incompatible solution on the tube, and then this will give side effect for the patient. Okay, after that, Edna gave patient medication. Yeah. While giving patient medication, I also answer on his patient concern about what the medication works for, what is the side effect of the medication. For metoprolol, it will low blood pressure. So have to see any side effect of like patient can be have headache while patient sit up. So have to be slow sitting up. Yes, so answer patient on the patient concern. Also, I can now monitor for the size of redness or swollen or any side of patient discomfort. Okay, after giving all the medication, I go ahead and flush the tube one more time. Okay. And then patient doesn't have any sign of redness or discomfort, I go ahead and remove all of my belonging out of the patient room. I'm gonna empty the tube and the sharpie, and then document the procedure I just done, I get recording document medication I was given, I medication I gave, the dose and the time, the site, the IV I used to admit the medication. Also, how patient tolerated the procedure. Xong rồi. So right now I'm gonna perform the IV push with the running compatible solution. The medication I'm using is ondansetron is 4 milligrams. And then the running solution is normal saline with the TKO, 10 milliliter per hour. For the ondansetron, 4 milligrams run over 2 minutes. The available is 2 milligram per 1 milliliter. But I need to also dilute with the same amount of the normal saline. So I have the tube is 4 milliliter as ready to be used and also label. Before I give patient medication, I gotta verify the doctor order. Use 5 rice for the medication administrations is right patient, right road, right time, right dose, and right medication. I gotta verify patient day and name and day of birth. Also for the wristband. I also check with patient allergy before I perform the medication. Since the tube is running, it's TKO, so I don't need to adjust the rate of the solution. But if with the solution running too fast, I have to adjust the medication for me to able to put the correct dose. So I'm gonna go ahead and lean the port. And then this one is 4 milliliter over 2 minutes. And then 10 seconds, and then allow 10 seconds for it to be dry. While giving patient medication, I also inform the patient what is the side effect and the purpose of the medication, and also inform patient how to report if any severe side a patient experience after provide medication. Before I admit the patient medication, I also check with the IV side, assess the IV side to see any sign of redness or swollen, any sign of discomfort or infiltration. During the IV administrations, I also assess the patient IV as well to see any sign of swollen or discomfort or infiltration. So after finish administering patient medication, I also assess again for the IV side and the side of redness or swollen. If patient doesn't have any side of redness or swollen or any side of discomfort, I go ahead and clean my area. I put this one, go to the shopping. Also document how patient tolerate the medication, what side of IV I given medication. Also like what medication, what are doses, and what time I gave patient medication. Hi, so right now I'm gonna perform the IV push with the running incompatible solution. The medication I'm using today is furosemide 20 milligrams. The available is 10 milligrams over 1 milliliter. So I'm gonna try 2 milliliter to be, and then also the label. Before I give in patient medication, I verify the doctor order. I check with right patient, right dose, right role, right time, and right medication. I also, because patient have running solution, I also check with the compatible with between the medications, and then the medication is running is incompatible with furosemide. So I'm gonna claim it, and then I'm gonna stop the running solution before I give in patient IV push. So I already claim it. Also, um, I claim it as well. I can lean the push. I can lean it 10 seconds. And then allow it 10 seconds for it to dry. Before I admit medication, I also check with patient IV side to see any sign of redness, swollen, or any sign of discomfort. Since patient is normal, I go ahead and flush the tube to make sure nothing remaining on the tube since it incompatibility. After that, I give patient the medication. This one is 2 milliliter. Gave over 1 minute. While I gave patient medication, I also assess the IV side for any side of redness, swollen, any side of infiltration. Also, like inform patient of the purpose of the medication and the side effect. Since it's furosemide, also inform patient have to increase the supplements of the potassium since it's remove potassium out of patient body. So after finish giving medication, I go ahead and flood the tube one more time to make sure all of the medication go to the patient body. After that, I'm gonna unglam the tube and then restart the running IV solution with the original ray. Assess patient any side of discomfort or swollen redness. After assess patient already, I can go ahead and empty this to the Sharpie and then document on the procedure I have done, the medication I gave and the doses, what side IV I gave to the patient, and then also the patient how patient tolerate the medication. Before I gave patient medication, I also like verify patient dual identification, also like inform like checking with patient allergy before I gave patient medication.